everyone, and thanks for joining Tackling Lab Data Normalization in HIE Case Study. My name is Jordan Leibovitz, and I'm part of the marketing team here at IMO. We want to thank Chic for getting the word out about this event to their members. And then before we get started, I want to take care of a few items for those attending. First off, this webinar is being recorded and will be available to you for future viewing. Throughout the session, all attendees will be in listen-only mode, but if you have any questions, please type them into the questions section on your GoToWebinar console. At the end of this presentation, we'll have a Q&A session as well, and we'll get to as many questions as we can, but if for any reason yours is not addressed, someone will be able to follow up with you after the webinar. Today we have two speakers, Deanna Town, Chief Information Officer at CORHIO, and Matt Cardwell, Vice President of Client Services here at IMO. As mentioned before, if you have any questions or comments while our presenters are speaking, please type them into the questions section on your GoToWebinar console. And with all of this being said, I would like to pass it over to Deanna.
Good morning. Thank you for setting this up, or good afternoon, I guess, depending on where you're located across the country. Very excited to be here and excited to have the opportunity to talk with our partners at IMO and highlight some of the great things that our partnership is enabling. I am Deanna Town. I'm the Chief Information Officer at CORHIO. A little bit of information about CORHIO. We are an independent nonprofit organization based out of Colorado, focused on exchanging health information technology. We have one of the country's largest and most successful HIE networks among many of our peers, other HIEs that are doing great things across the country. Our goal really is to provide critical information to the healthcare community and to exchange the data in a way that's meaningful and enables improvements in patient health and patient care. And as you can see on the slide there, we have grown from 3 initial communities into really being a statewide HIE with a presence all across our state, continuing to expand and both in terms of our geographic footprint as well as our product footprint. In addition, Matt, if you don't mind moving to the next slide, thank you. We have a high level of utilization. So our HIE serves 75 hospitals right now in terms of being live, 67 of them sending data into us. And we have lab data coming in all day, every day, as well as close to 60,000 ambulatory care summaries being added per month. So huge volumes of data coming in, obviously aligning well with why terminology services are so important to us as an HIE. We send over 6 million notifications per month out to our member organizations and cover over 8 million unique patients or identities within the state of Colorado, as well as another almost 1.5 million nationwide, with over 21,000 users and more than 7,300 providers participating in our network at any given time. And then lastly, we can transition. We have a significant number of different data types exchanged, and I think, again, this ties to what we're going to be talking about a little bit later, about different code sets and different types of normalization that IMO provides and that we're partnering to build out. But we bring data in from our hospital partners, as you can see there, lab, radiology, pathology, transcription, and ADT, but also pull data in directly from those labs and radiology centers. From public health departments. So this is very timely in terms of immunization information, newborn screening, and reportable conditions coming through the health information exchange. And then the aggregation of care summary documentation that we pull, aggregate, and push back out. Those come in from ambulatory providers, Department of Defense, Kaiser. We have a partner HIE Quality Health Network within the state of Colorado, and partner with various other health information exchanges. Next slide, Matt, thanks. And then just a quick picture that I hope ties together everything I just introduced in terms of who CORHIO is. The basics of HIEs, if you don't know, pull together all sorts of different, very important data types from hospitals, LTPACs, to public health departments, labs, and really help to build out that community health record for a patient so that the best care can be given with the most and maximum amount of information available. So that's a little bit about CORHIO and what we do, and I hope that sets the stage for the continued dialogue about our partnership, again, with IMO and where we're looking to go in the future. I'll hand it over to you, Matt.
Well, hey, thanks so much, Deanna. It's been a pleasure to get to know you and the rest of the team over the last few months, and I'm so excited to share some of the things we're working on today. Before we jump in, I'll introduce myself. My name is Matt Cardwell. I'm a VP of Client Services at IMO. I've had the pleasure to be part of this organization for the last decade, building, deploying our products across the industry, and it's truly humbling to reflect on the impact that we've been able to have, enable discrete data capture, supporting interoperability, and super powerful to think now about this data moving from clinical applications to places like health information exchanges and what we can now unlock together. So just to jump into the conversation, Deanna, I'd love to hear your own reflection on the power of HIEs from your position as a leader in this space. Can you talk about the importance of this infrastructure and what it means, especially today during a global pandemic?
Sure. HIEs, I think, are uniquely positioned today and into the future to be the pipes that help to exchange data across various disparate systems. I think we've seen the market flooded with great and really innovative new health technologies, but the power comes from having the data from all of the different sources already together and already stored and already in clinical data repositories that pull from these different systems that may be the primary data storage location for that type of data, but not necessarily an aggregator. HIEs serve as that aggregation point and also already have the connections, I call them the pipes, the interfaces, the integrations, even the business relationships and participant agreements and legal documentation in place to serve as that distribution point and to be able to make sure that data is being exchanged and used in a way where it's not just data storage, we're actually giving the power of information and getting that into the hands of the people who really need it, either to make policy decisions, regulatory decisions, patient care decisions, or even the patients themselves being able to make sure that they understand all of the data available moving forward.
No, yeah, truly powerful capabilities. I'm sure you saw this in last month's JAMIA that showcased some of those impressive results, really measuring the impact that an HIE can have aggregating patient information. And the measurement that that was posed and demonstrated was improvements in quality reporting based upon pulling information from an HIE versus just a single clinical application. And I mean, I sit here and imagine the application of those findings just to patient care overall. So I think certainly some powerful things that these technologies can do. So I appreciate the backdrop, Deanna, and always essential to maintain that tether to why we do what we do together. I'd like to zoom in here and talk about the work CORHIO is doing today around enterprise terminology services. You're building out new capabilities there, IMO being one piece in that technology stack. Can you talk about the conversation with your leadership? How do you get them to lean in on something that might be as seemingly esoteric as structured terminology and clinical vocabularies?
Sure. CORHIO has adopted a model where we're a bit of a hybrid between best of breed technologies, which there are a lot out there, and internal development. And we recognized early on and continue, I think, to emphasize or re-emphasize the need for both. So there are some areas where we have decided that building internal to our own organization is the path we wanted to go for the autonomy that it brings to our organization, but also the flexibility. There are other areas, patient matching, for example, or terminology services, where we really lean more towards leveraging that best of breed, where there are entities out there that are very, very good at doing those specific things, and pulling them in allows us to augment the other development efforts that we're doing. So in this particular case, I view terminology services as a very strategic investment. It's an enabling technology. It certainly isn't something that we can go and sell in terms of terminology services. That's not what we're in the business of doing. But like patient matching, it is the enabler for various products and services that we are currently or looking to build. So that again, then once that technologies in place, we have the ability to build upon it and to continue to build out new products and services. And so for us, we recognize the value of the data that we have, and more importantly, we recognize the value of ensuring that we understand all of those data elements and that we have done the best we can to normalize those and to provide products and services at the highest level of accuracy and integrity possible. And so the partnership, we're looking forward to having enable a lot of that focus area.
No, well said. And I know we're beginning our journey with lab normalization. Can you tell us more about this starting point?
Sure. Our focus up to this point has heavily been on leveraging lab normalization, but we also see the value, and I think every HIE does, in terms of being able to normalize additional types of data, whether it's medication information or continuing to improve normalization around diagnosis codes and diagnostic information. Having a great deal of depth and maturity in a specific data set is very valuable and very important. Being able to do that across data types and across data sites really, or data types really gives us greater insight into all of the pieces and how they come together. We found quickly that most of the time the real value, especially in analytics, comes when you're crossing. Again, here's the diagnosis, here's the labs associated with that. It's great if you can match with the claims codes that tie to those, and really be able to kind of paint that full picture. And especially again for the analytics capabilities, that's where we're looking to head next, and very excited to see what comes.
Got it. Very interesting. And I know you're thinking about things like social determinants and how we bring these data together to meet the needs of the community. Anything you can share along those lines?
Sure. As social health information exchange and social determinants of health continues to be something that is popping up all over, and I think there's a key recognition that the importance of that data married with clinical data is really where we can get the best whole person care and really the best outcomes for the patients that everyone's trying to serve. As I mentioned before, HIEs already have integrations. We already have various data types coming in. The addition of data types has happened over time, and it's a very logical expansion. So as social determinants data becomes more readily available, having that type of data come in and route it through the same pipes and the same HIE infrastructure, but now being able to add it to, hey, we've got an individual who has food insecurity, and we know they also have this set of clinical factors as well, or the other way, right? A provider who's trying to provide very specific clinical care, having an indication of, I'm dealing with a patient who has food insecurity, that logically ties to maybe some of the health outcomes or health impacts that I'm seeing that this person's trying to tackle. Aggregating all of that data and having that available is really important. And so is, we've seen a huge focus lately on health equity, and ensuring that vaccine distribution is a great example of an area where I know there's a ton of resources right now being focused on how do we make sure distribution is focused with through a health equity lens. HIEs already have a massive amount of data, and in that data that already is existing on a longitudinal record for a patient is more than likely some of the data elements that would be needed for that health equity focus or the health equity analysis, race, ethnicity data. It's already coming in, it's already in those HL7 messages. So how do we look at HL7 messages, which would historically be, these are hospital feeds, and how do we tie those then to the larger social determinants of health, health equity focus, and really start building out a much more powerful and robust data set?
No, it's truly exciting, to think about our small role in this and what the future holds together. Deanna, could you contrast for me what's different with this go forward approach now versus the existing process?
Sure. So what we're looking and what's in process now with IMO is real time application of terminology services. So prior approaches have been very successful in terms of continuing to apply updates, but what we wanted was something that gave us the maximum agility to respond to really a quickly and ever-changing market and needs, really. The demands coming into the HIE are changing constantly as the universe of healthcare is changing. And so having real-time normalization for us was really important, so that as data flows in, as soon as it hits our door, we're identity managing and applying terminology services. And so then it feeds all of the downstream products. And that's a little bit of a pivot in what's coming. We also were looking for something that had very frequent code set updates, just to make sure that we're staying, again, the world today doesn't look the same as it did 6 months ago, and it certainly doesn't look like it did 18 months ago. So the IMO provides the update 6 times a year, which for us was really advantageous. It matches with regulatory requirements, but also more importantly, I think, demonstrates that it's meeting that customer need, that no one was watching for COVID-19 lab codes a year and a half ago, at least not to the level we are now. So how can we put processes in place that allow us to adapt to that and respond as quickly as possible?
No, thanks for your insight. I always love our conversations together. Today is certainly no different. And I'm sure your peers that are listening in today are appreciative of that opportunity. Before we move to a brief time for some questions and answers, do you have any final counsel to share on this topic?
Sure. I would certainly say that again, enabling technologies are hard to focus on because they're the behind the scenes. They're the things that make the shiny objects, the exciting products, the things you could put in hands of providers and users. They're what make those tools work, but they're not necessarily the tool itself that can be consumed. And so I think ensuring that there's a balance of making sure that the products that go outbound meet the need and are fit for use, but also making sure that that technology behind the scenes really is as robust and powerful and agile. And making a reasonable investment in that is really important, because upon that infrastructure, any number of new products and innovations can be built. It's hard to go back to build something new and innovative and then go back and try to put the platform pieces in place. And so taking the time to really build that out, I think, has been something that we've invested a lot of time and continue to do and find very valuable. I also think it's important, IMO brings a great deal of clinical subject matter expertise, and we are leveraging that heavily. We also recognize that that's a skill set we need some internal resources to have, and it's a balance, it's a partnership. And so I think calling out that, as with any vendor partner, recognizing there are investments on both sides that need to be made. We've added a clinical standards advisor to our team who is fabulous and phenomenal, and we're so excited to have her. But having that type of skill set to partner with an entity like IMO really brings a great deal of value to the organization, because you want that nice blend of vendor partner that can meet the majority of your needs and clinical internal subject matter expertise to help partner along the way.
No, and certainly appreciative of that partnership. Always a two-way street, and I know we're both learning from each other on this journey. So we'll move to some questions now that have been submitted from attendees. Just as a reminder, you can find the Q&A in the GoToWebinar panel. So if you haven't asked something already, and you've got a question for myself or Deanna, please drop into the chat. But we've got a couple already. This first one is to you, Deanna. What else has CORHIO done over the last year that will have an enduring impact post-COVID?
We have spent a great deal of time and energy and focus on building partnerships with other health information exchanges. So really not just having dialogue, but formalizing some of our engagements across the HIE landscape has been hugely valuable, as well as really looking at how do we aggregate data across and what roles can HIEs serve fairly easily. You know, where do we have the 80% already in place, and it's building out that last 20% to really meet the changing needs. So we have invested a lot of time and effort in that area. We've also matured a great deal post-COVID in population health analytics. And again, recognizing that we had a lot of the data already stored in the HIE to enable powerful analytics, in investing the time and resources to really enable that as a tool set and as a functionality has been very valuable for us and continues to be an area that we are exploring. We've also learned that sometimes the data that again is already coming in can be used for use cases that are new and innovative and that we hadn't thought about. Leveraging ADT, kind of admission, discharge, transfer notifications for tracking bed availability or bed capacity. It's more of an art than a science probably at this point, but it's an area where data is already coming in. How can we leverage it differently? How can we look at this through a different lens? How do we tie these pieces together to really get a lot more meaningful output? So those are the areas that we've been focusing on, and I think we will continue to expand. And it's been a terrible and exciting time kind of together, right? It's the worst of the things we'd want to be dealing with, and also brings opportunities that I think we hadn't necessarily seen in front of us, and now we do.
Yeah, no, we've certainly seen that across our client and partner base, just using this time as an opportunity to, think through strategic investments in this space, use of data. I think all of those are powerful themes. Let's see here. Looking at some of the questions that have come in. Deanna, is CORHIO sending reportable labs to their Department of Health? If so, any challenges with this?
We do provide the reportable lab functionality and interface, so we do feed the data into the state repository, yes. Challenges that come to mind, nothing's coming to mind as an overt challenge, but I will continue to think about that. If something comes to mind, I'm happy to readdress that before the webinar ends or as a follow-up.
Yes, and not surprisingly, a question about handling normalization of lab codes when sites keep sending local codes for lab tests instead of link codes. So if you were trying to aggregate COVID data, how do you do that? Certainly a challenge that we're tackling day by day, Deanna. I can provide some insight there, but maybe you start with just your perspective specifically, and then I can layer in the portion that IMO is supplying.
Sure. I think at the most basic, I mean, yes, that happens. Would I love to wave a magic wand and have every data sender send exactly what we're looking for? Yes, the answer is yes. That isn't the reality, and so I think having the continued communication and dialogue, especially around not only when things are being sent as local codes, but when things change, when a local code is updated or modified, making sure the path of communication is open. I mean, that's what HIEs do really, really well, I think, is bring data from disparate sources and be able to map and understand that and make that meaningful and store it in a way that is meaningful downstream. But ensuring that there's an open line of communication and a dialogue so that mapping, even if it is just to a local code, occurs, that it's accurate, and then most importantly, that it's maintained in a go forward state, I think is probably the most important. And then Matt, I'll hand it over to you for the functions that IMO does.
Yeah, sure. So So what's implemented at CORHIO right now and is supporting the understanding of this lab data is our product IMO Precision Normalized, which can take codes, it can take in this case local descriptions of lab orders or lab results, and then be able to understand those using IMO's foundational clinical terminologies that as you saw on that first slide are widely deployed throughout the United States. So it gives us, certainly still a difficult spot, right? I think we know the challenge. I think Deanna was right to comment on the role and partnership of having a clinical subject matter expertise who can evaluate some of this, but doing that in concert, being able to supply and add back codes that might be lost in all of the various hops that data takes along the way, and being able to do that in a scalable way. So providing great content, great technology that, as Deanna alluded to earlier, can be scalably implemented in not just health information exchanges, but clinical data registries, other healthcare infrastructure, and the IMO product can do this both on a transactional basis as well as supporting some bulk normalization capabilities. Let's see, the questions have slowed down a little bit. This might be the last one here, Deanna. For those who are just starting out, maybe don't have a terminology strategy today, what's the first step that they should be thinking about right now?
I would start with product strategy. What products are out there, product management and product strategy. So what products are you leveraging right now or are you selling that would benefit from having enhanced terminology services? What products are you not selling or promoting or haven't built that would benefit from terminology services? And then balancing that with where do you have resource availability to really be successful in standing up this capability and ensuring, again, that it's a partnership. I think there has to be thoughtfulness about any time you're adding technology to the stack, being able to support it and being able to maintain it and having the bandwidth of resources to build it out and to do all of the things that it could do to add value to the organization, and ensuring that, again, the products that are being built and pushed out can support that enabling technology that's needed to really make them successful. So I think thinking about all of those things is really valuable. And then just continuing along the way, building a product is one thing, but continuing to iterate upon it and making it even better, making it meet new use cases, and having that continual service improvement and continual feedback loop is really valuable. So I think that's how we've landed where we are today, and what has enabled this partnership, and look forward to see what it brings in the future.
Well, I know we're right at time, Deanna, so I think that's as good a note to end on as any. Again, super appreciative of you, your time, and our partnership with CORHIO, and looking forward to the next time that we can talk about the great things that we're doing together.
Thank you very much for having me, and thanks for the partnership, and I hope you have a great day. Thank you.